Merci beaucoup. Thank you, Jonathan and Bernard. I'd like to ask where culture and cultural differences feature into your virtue-guided approach, and then Bernard, similarly, how cultural differences factor into your perception of and your discourse about autonomy in this context.
I'm not sure I can answer that from the report off the top of my head, so I might have to look over lunch and see what's there. I mean, I think we were very anxious when we looked at the questions of equity and access, that the interests in doing this work were actually coming from quite a narrow range of society, and we were identifying that then created challenges in terms of it being more broadly accessible. I'm not sure that we particularly picked up that those differences might be driven by cultural differences as opposed to socioeconomic differences, which was our main concern there. I think our analysis was thinking of things as being in quite concentrated groups at this stage, and we probably need to think about that coming forward. I think our principle of caution would enable us to say, actually, as those things emerged and things became transferable, those are quite significant issues. What we didn't deal with, but I think it reflects the particular cultural context in, is the collective consent type questions that you were raising very interestingly about native populations.
What was the impact of this report on the regulatory framework in UK? If there was some, by the way.
In terms of big change, we wouldn't expect to see very significant changes just in the UK, because essentially the two frameworks we're talking about in terms of legal regulation, clinical trials directive to become regulation, and the devices directive are European-wide. What we have been looking at is the slightly softer end of regulation. So we've looked at how you get some bite on collecting this evidence. So within our system, we have some experience of other technologies where national government initiatives have been taken to create registries, so that there's an expectation on clinicians, reinforced by the employment expectations of most of our clinical researchers who are working in a nationalised socialised medicine system, reinforced by expectations of our Research Ethics Committee approvals, that they would use these systems, that if there are registries available, it becomes then unethical not to contribute to them. And then once it's become unethical, there are potential regulatory sanctions for professionals whose license to practice depends on regulation with their professional bodies. So there's a strand in which articulating those standards gets some reinforcement. But the most important ways through are, how do you make that actually accessible and available to people to use? So there have been two main things there. One has been the work I alluded to with the National Institute of Clinical and Healthcare Excellence, which identifies standards for NHS usage, and it's producing guidelines as some of these technologies become more widespread, which says you should only use them alongside using an audit tool which is published along with its guidance, to which you can contribute the data, so that we'll be able to then look and see what we've learned, and NICE can reassess the effectiveness of that guidance. Equally, the specialist health professional bodies, so not the statutory regulators, but the learned society type equivalents, have begun to work on models for registries in some of the areas, and we've been in discussion with them about how we can take the values of the report into that framework. So in a hard regulatory sense, it's about influencing the application and interpretation of the European legislation, although, as you will know, there's quite a lot of scope for that being done flexibly. We've worked with the regulatory authority, which in England is the Medicine and Healthcare Products Regulatory Authority, to streamline and dovetail approval processes. And at the moment, one of the issues there around the stem cell trials is that safety sits with them and ethics sits with the Research Ethics Committee. So while we can't alter that regulatory framework, we can get memorandum of understanding about how they operate together. And we're just launching, and this is my Health Research Authority hat on. We're just launching a process whereby we're putting some resource into managing research approvals processes via the Health Research Authority, which will include managing a timetable of putting in the safety regulation decisions into a single managed timeline to get decisions on projects and whether they can go forward or not. So at high level, you probably wouldn't notice it. Under the radar, we hope we are not minimising we're keeping the scrutiny, but we are reducing the bureaucracy that goes with that scrutiny and making it more manageable.
Thank you very much, Jonathan, for your intervention. Thank you for Bernard's response. But in your interventions, I was lacking some words or some semantics, because we are speaking about neurosciences and we didn't speak about the tension between identity and plasticity, which is crucial to this ethical debate, or between the tension between vulnerability and autonomy. And I didn't hear the term consciousness. And etymologically, consciousness means to do science together. So I think these words are crucial to the debate, and of course the Nuffield Council has a pragmatic approach, but there is a tension in between the discourse of Bernard and yours, because the fundamentals of the ethical discourse are different. You are a bottom-up approach, very materialistic, and Bernard used the notion of autonomy without articulating it to the clinical aspect. So will it be considered in
the
Council? Thank you.
I'm not sure I accept the premise that those concepts are not in the analysis. I absolutely agree that we've approached this on a pragmatic bottom-up approach, and I've particularly stressed the move to the regulatory framework as there. But the way in which the Council operates is to put together a group of people from different disciplines and invite them to reflect on an ethical framework that for them makes sense of those questions. So I can absolutely assure you that those languages were discussed in some of the early drafts, and they were around tensions that were being picked up. Now, I think and I think in part this came from the discussion with Bernard, it's not that the issues around identity and plasticity are absent, it's that language was not felt by the working group to take them very much further in terms of the regulatory structures that were there. So I mean, I think that I've tried to explain how what is sometimes put together in a single set of discussions around what autonomy might mean, I think is in the report, but it's under different headings. I think that's probably true about the challenges to the sense of self, the identity plasticity. I think that is there, but not in those languages. The consciousness stuff is very technical. It's in the early chapters about descriptions about what's there, but I don't think it comes through very strongly as a conceptual tool. So I think I'd accept that's a fairer and closer critique. The others, I do think those issues are there. I think the language is different.
It was not a critique, it was a remark. Thanks.
D'autres remarques et questions? On voit à quel point ça a été le cas dans la présentation de Judy sur la question des découvertes incidents inattendus. C'est le point là sur le rapport, la contextualisation, the context in which a certain exam or a certain device is used. And it's going to be more and more difficult with, for example, the video games that are now using some device to record some brain activity to be part of the game. And these companies are also collecting this type of brain activities. So is it a game and just something to enjoy? Is it already a brain device? Is it already something we have to regulate as a collection of brain activities in front of a certain game where some regulatory body has to intervene in such things?
A quick answer is yes, isn't it? I think that's, we set out to try and get more information than we were able to find about both the military and the gaming technologies. Our assessment of what was going on in the gaming industry was that actually there's relatively little at the moment, that really does that. So some of the stuff that we were initially expecting to be somehow examples of collecting information from the brain or intervening in the brain mostly was about movement sensors as opposed to interventions. But I think and hence from that we said we should, devices that generally did intervene and take stuff from the brain, we should get into a regulatory framework which enables us to learn from them, because there's as much learning available from that and as much risk available in that as there is in the medical context. What there is not is an alternative regulatory framework that comes from the fact that the researchers have to go through approval processes, clinicians are regulated. I think it's very difficult to reinforce that. On the other hand, I think the significance and the risks currently with the technologies around neuro aspects of gaming and the collection of data are much less significant than the issues about personal privacy and identity and control from the collection of our search histories. There's an issue we have to grapple with as societies about how we see the respect for autonomy, which is probably, well, perhaps better in phrase in terms of privacy, because actually mostly if you take that version of autonomy which is freedom from encroachment, we mostly sign up to these things, we agree to them without thinking about it, because we download the software, we click the boxes. So if you take the lawyer's version of that encroachment thesis, and this is one reason why Nuffield is not particularly enamoured of it, it can very easily collapse into a risk transfer. So rather than genuinely addressing the interests that people have in privacy and autonomy, what it does is to indicate that they've said it doesn't matter to them. And I guess you could see that, picking up some of the off-target findings issues. The neatest solution to the anxieties around should you tell people is you give it to them on a memory stick, and you say you don't have to read it, but you have it there if you want it. And that would be a lawyer's version of saying, well, I've just handed the problem over to you, and I've absolved my responsibility. Now, I don't think that's sufficient to grapple with our concerns and our responsibilities as clinicians, regulators, thinkers.
There is an collective expertise report of Inserm this year about addiction to video game in teenagers. So this might be the beginning of some new story about some brain device that are not research, not medical, but societal.